Hello everyone, my name is Cassie Howell, and I'll be introducing our presentation on the bacterium called Yersinia pestis, which is known for its deadly outbreak back in the 14th century and called the Black Death. Plague is a highly contagious zoonotic disease, which means it can be transmitted from animals to humans or from person to person. There are three main forms of the plague, which are differentiated by how the bacterium is transferred and where the initial site of infection occurs. Bubonic plague is transferred by the bite of infected fleas, commonly occurring on the extremities. It's characterized by the development of swollen lymph nodes in the groin, arms, or neck. Bubonic plague is a more serious form of plague that spreads through tiny droplets in the air from an infected person and affects the lungs. It's characterized by fever, cough, chest pain, and shortness of breath. Septicemic plague is the deadliest form of plague because it occurs when the bacteria enter the bloodstream directly or developed from untreated bubonic plague. It's severe and rapidly progressing form of the disease and can cause organ failure and shock. Throughout the presentation, we will cover symptoms and diagnosis, historical significance, and the treatment and prevention of this disease.
Hi, good evening, class and professor. If you're watching this video, then you've gotten to the second part of our power presentation on Yersinia pestis, what is plague, And today I'd like to talk to you about the symptoms of three different types of them, starting with bubonic plague, which is actually the most common form of plague. Unfortunately, I didn't get the historical part of that, which is kind of like the most interesting part. But I guess symptoms can be kind of cool or not cool, But when it comes to the bubonic plague, these can really be distinguished by lymph nodes. Lymph nodes are known as buboes, which can be found typically on the neck, the armpit, or the groin. And you actually get a lot of very similar symptoms to other infectious diseases like, fever, headaches, chest pain, cough, shortness of breath, which can be a problem because they can be misdiagnosed if not careful, which I will talk about later in this video, how to best diagnose them. Right, and when it comes to the bubonic plague, I do have some pictures, videos, but they're kind of gross. I kind of don't want to show them to you. But you'll notice these lymph nodes, if left untreated, they can expand from typically 1 centimeter to 10 centimeters, and if it can be pretty lethal in 50 to 60% of cases, but it's actually like the most common form, and they can be treated by antibiotics, but usually 24 hours you want to be at the hospital by then because they will expand. Secondly is the pneumonic plague, which is, of course, the more severe form of plague itself, and it affects the lungs. Now, these symptoms are very similar, but not as grave, as the bubonic plague. But you'll get stuff like fever, cough, chest pain as well, shortness of breath. But this one's severe because not only is it affecting the lung, but if the bacteria from the lungs travels into your bloodstream, then you can get into some really, really big problems. Which actually, if it does end up going to your bloodstream, then you could get into this type of necrosis, which is the most or all of your cells dying in your organ or tissue, which is the third and final plague that I'll be talking about, the septicemic plague or septicemia, something like that. This one, unlike the bubo plague, you won't see any lymph nodes or buboes, but it is the most life-threatening because, well, if they're in your bloodstream, then they can, it's a lot easier for them to multiply or proliferate, and be aware that you can get secondary pneumonic plague. These will typically be, spread among people from just droplets of, when people go and cough and stuff like that, please wear a mask. Right, this video has gone way too long, so please hit the like and subscribe button. Thank you.
Hello, my name's Alexis, and I will be presenting on the history of Yersinia pestis. So the bacteria Yersinia pestis caused the plague. The plague has caused 3 epidemics in 541, 1347, and 1894. The plague has infected all parts of the world, and starting in 541, the Justinian plague started in Central Africa and spread to the Mediterranean and Egypt. This plague was named after the emperor of the Byzantine Empire at the time, Justinian I. During this time, it was written that the world had never seen an epidemic such as the plague before. Constantinople was hit the hardest, with deaths reaching between 5,000 and 10,000 deaths per day. By the year 546, the plague had killed 100,000 people all across Europe. This horrific event caused the downfall of the Justinian and a famine that lasted 8 years. In fact, the plague of 541 caused a change in the government and a way of life all across Europe. The plague in 1347 is perhaps the most famous form of the plague. It was called the bubonic plague or the Black Plague. It spread from Asia to Europe and all the way to Russia. This is the most well-known form of the plague and has the most adaptations in pop culture. The Black Plague was spread through sieges and sea traders. Most people believe that the bubonic plague was a result of angering gods, so they would pray to the saints. The plague killed off families and villages, and it started the rise of the middle class. In 1894, the third form of the plague spread from Yunnan, China, to India and all the way to Hong Kong. From there, the plague moved to the rest of the world. This pandemic started from rats. It spread to other countries through trade routes. It was figured out that the plague was caused by the bacteria Yersinia pestis by Alexander Yersin in 1894. It was also figured out that the brown rat was the carrier by Paul Louis Simon in 1989. The next slide, the epidemiology. Yersinia pestis is presented as a couple different diseases. The most prevalent and famous is the Black Death or the bubonic plague. The bubonic plague is responsible for 80% of the deaths caused by Yersinia pestis. Over the years, the bubonic plague has wiped out villages, families, and parts of countries. The Black Plague killed millions of people before making its way to the U.S. in the beginning of the 20th century. In recent years, there are around 10 cases of the Black Plague a year in the U.S. Most of the cases in the U.S. are in northern New Mexico, northern Arizona, southern Colorado, California, southern Utah, and parts of Nevada. Most modern cases are found in Africa, with more than 1,000 cases between the years 2013 to 2018. Most of the cases are in small villages or rural areas rather than bigger cities or capitals. The bubonic plague is found during the summer months
It can only survive between around 10 to 25 degrees Celsius with high levels of humidity. This has not always been the case. Throughout history, the prevalence of the plague has changed due to the birth of rats. So there were some years that it was more prevalent to have the disease in January or November, but in current years, it's the warmth in the summer months. In recent years, the disease has been deadly, but there are not as many cases as in our past history when there were epidemics. This is possible due to better medicine and sanitation. WHO cites that there are around 10% of deaths due to the plague yearly, but this statistic could be much higher depending on where you are. Thank you.
Our presentation on Yersinia pestis with the treatment and prevention of this bacteria. So to start off, I want to talk about the prevention, and that's going to look like preventing any other bacteria, just making sure your hands stay clean, you're sanitizing and cleaning your living space, making sure that these rodents and insects are not infesting your home. As my team members mentioned, the transmission is through saliva and fecal matter of rodents and the bites of insects. So making sure you stay away from those type of things is going to be the best prevention, especially from your own home. If you are going outside, you're going to obviously want to stay away from wild animals. Don't want to get bit by them, and maybe take some bug spray. Make sure you're keeping those insects off of your skin. If you are diagnosed with the plague or finding out that you have Yersinia pestis in your system already, the treatment is just going to look like antibiotics. So before we get into the type of antibiotics, I want to talk about a little bit of background on the bacteria. So Yersinia pestis uses what's called Yersinia pestis outer membrane proteins, or YOPs. These proteins are effector proteins that attack and cause a lot of issues to your cells, often the cell membrane, so that it can infect and spread further throughout the body. So because it's of its virulence determinants and its resistance to a lot of other medicines and the immune system, doctors, scientists, and our technology today have created what's called aminoglycosides, which is a type of antibiotic used to halt the protein synthesis of the bacteria. This will stop those proteins from attacking the cells and halt it from spreading throughout the rest of the body. Now, with natural evolution and the bacteria, it is possible that the bacteria can create a resistance to these antibiotics. And so, again, with that technology that we have today, we have created what's called novel aminoglycosides, which have just been designed to overcome that resistance to those antibiotics. And so that is the main reason that we have gotten our cases down to only 10 cases a year. Part of the biggest reason that it was such a big deal in the past is not having the technology to attack those proteins before. A little bit on the etiology of this bacteria. It uses a flagellum to move around the body and from cell to cell, and then uses a type 3 secretion system to move those proteins from the bacteria to the cell. With that, it's also able to thrive in a vast range of environments, that including food left out, and especially host animals and humans. The issue is once it does infect the host, it can attack the immunological responses, or at least evade them as well. And that's why it's such a big deal, because it can really cause some issues with your immune system. And that kind of wraps up our presentation. The rest of our slides have our fact sheet and summary. And just to finish off with our summary, Yersinia pestis is a deadly bacteria that causes the deadly disease called plague. There's a few different types of plague, but if you are ever diagnosed, consult with your doctor. Make sure that you're getting the correct treatment. And that wraps up for Yersinia pestis. Make sure you're keeping your hands clean, stay sanitized, and watch out for those bites. Thanks.